Day after day, this virus continues to spread, not respecting boundaries, color, or gender. Worldwide, there are more than 1,500,000 cases of coronavirus and more than 100,000 deaths have been reported. COVID-19 is thought to have a higher mortality rate than the seasonal flu. And you might ask yourself, who is fighting this illness? Who is saving the lives of thousands of people? Well, we have with us today PA Nidha Azam, located in New York City, the epicenter of the US coronavirus outbreak. Neda, on behalf of the Students Against COVID, I'd like to extend my warmest thank you and welcomes for accepting to talk with us today. We are a global movement that is determined to make a difference during this unfortunate crisis by trying to interview and talk to patients, survivors, and doctors who are on the front line.
Thank you for having me.
Neda, I'd just like to start by asking you some questions, if you don't mind. Most people actually compare our situation to almost being in war. How does that resonate with you in the clinic, and how close do you think we are to the finish line?
So, oftentimes we compare war to being sudden, unprecedented, without warning. All those, I would say, are exactly what happened here. I would say one day I was treating, honestly, 1 week I was treating just regular diabetes, blood pressure, cholesterol. I was doing physicals. I wasn't wearing any PPE. And the next week, we were in the middle of a crisis. All of a sudden, this virus was here. We had positive cases in Nassau, which is, the area that we're in. And we found ourselves unequipped. We didn't have the proper personal protective equipment. We didn't know how to now see patients that we needed to see, obviously, as a practice. We didn't know, what kind of medicine we should switch to. There was so much confusion. And in regards to how far along we are, I feel as though we're like the crux of it right now. New York has so many deaths. Number is climbing. At this point, we know people personally who've been affected. Personally, we know lives who've been lost. We're scared for our families. I don't really find it being towards the end. I feel like we're right in the middle, and we still have a good few strong months of a very strong fight by some very tired people ahead of us.
Okay, thank you for your answer. We'll talk more about that, but I just want to take your opinion on something. So a lot of people assume that it's only the elderly that would die if they caught this illness. Based on what you're seeing day to day, how true is that statement?
So I think the scary part in all this for me is that although the elderly are very much affected more severely than the younger population, there is a significant younger population that is also affected, and also, like, young, especially my patients in particular, who have asthma, who have diabetes, who are obese, like, I worry for them, those who are any kind of immunosuppressants, I worry for them because they also fall into that category of, pre-existing conditions. The elderly, obviously, I'm noticing that it's harder for them to recover from this if they've been affected. Oftentimes, I'm finding them that I do have to send them to the emergency room. The younger population, I try to manage as much as I can, best I can, outpatient. But of course, I am hyper alert that if something, if they develop shortness of breath, I always say, call me. And if you can't reach directly to the emergency room. So we can't tell the younger population that, hey, listen, like, you can just relax and, like, it doesn't affect you. Like, no, you very much are affected. You very much can also spread this.
Exactly. You raise a very good point, because a lot of people to this day are still ignoring these red flags, and they're just continuing their lives, going to beach, going to each other's homes. And I think that's a huge thing that we all should consider, that us as 17, 18, 19, or even 25, we are all prone to this illness. This virus does not discriminate.
Right.
Right. So the next question I'd like to ask you as a PA, so every healthcare worker is really important every single day at any given moment, but specifically now, how has this virus affected PA specifically, and how you deal with patients?
Like I mentioned, PAs, we are mid-level providers. Like our role has been created to alleviate physician burden, right? In a way, we go through like expedited medical training, but it is still medical training. It is very rigorous. It's very intense. And we're basically there to fill the gap, right? So if there's not enough doctors, like there's PAs, and if there's not enough PAs, there's nurse practitioners. So, I mean, in this coronavirus, I'm seeing that like we are all such a unit. I can't do my work without my medical assistants, I need my supervising physician, I need my medical assistants, I need my staff, I need my nurses, I need literally everyone. It is so not just I'm the only one being affected. I also just learned that my medical assistant tested positive and I worked with her all day Saturday, so for me it's that if one of us goes down, all of us goes down. And if one of us rises, all of us rise. So in a situation like this, we have to make sure we're all protected. We're all doing our best. And I also mentioned PPE is really hard to come by, has been very hard to come by in my area of work. I was able to come across some N95 masks and I went and delivered them. And I was like, hey guys, wear them because it's not just about me, it's about all of us. You get sick and you can very well get me sick, So it's hard to say about PAs alone because I feel as though right now we are such a unit and we are so ingrained in this together that we are all affected equally so. The doctors, the PAs, the nurse practitioners, the MAs, the nurses, like we're all just running and scrambling and hoping that we can keep each other safe so that we can keep doing the one common goal that we have, which is to protect and heal our patients.
Exactly. That's why we need each other, and we need a well-established one medical team. Thank you very much for that. So, in the beginning, many people have doubted the capability of social distancing in terms of reducing the rate of this infection. Do you think that it's working, and what other measures should the public implement?
So, social distancing, although it took a while to implement, it took a lot of hard lessons for it to be implemented. I mean, where we are living through that hard lesson, we have so many positive cases here. Honestly, I stopped looking at the numbers because it just depresses me so much. I just know that it's a lot. And I know it's a lot because I have, friends, parents who are passing away. I have, friends who are directly affected. I have friends who are sick. I have family members who are sick. So at this point, this is the lesson. Like, thank you. We should have done this, months ago when we had the warning. But when you don't have the right kind of leadership who plays this down, and I get it, the economic impact of this is profound. Local stores are closed indefinitely. People are laid off indefinitely. But I'd rather they be laid off than be dead. So for me, it's like we should have done this forever ago. I encourage, I always say people, even to those who are positive, who are not positive, I'm like, stay home, quarantine yourself best you can, limit contact, have your groceries delivered if you have that service available to you. If you really wanted to build that shelf that you never got to do it, well, now's also not the time to go outside to get supplies, So, order things online and, we have essential workers in place who are carrying this burden for us. And I'm so grateful for them. In every single area. But I think that if you are able to socially distance, which also is a privilege, you should 100% do it. And what other measures we can take? I mean, I think the implementation of the masks for kind of everyone, I think has been really good for, the droplets that you can kind of spread, via air. Just the fact that everyone is kind of covered, I think that's really helpful. I think at that point, social distancing and masks should, in my opinion, get us through the worst of it.
Great. Thank you so much. So, as you have mentioned to me previously, so right now you are asked to do more with less. Are you noticing a great deal of shortage in PPE in your city or just in your hospital? And what are your thoughts on that?
I laugh because otherwise I would cry. It is so sad how little PPE we were provided. I think 3 to 4 weeks ago, I was given one N95 mask, and I was given one gown only maybe a week and a half ago, which I reused. So we wipe it down, we Lysol it down, we take our precautions, we put it in our Ziploc bags, we Lysol that, but in terms of like an abundance of personal protective equipment, there isn't none of that. Like, we watch YouTube videos to how to protect our N95s, how to make them last longer, how to not soil them. One of my colleagues even made me an eye shield because we didn't have any. And at this point, we are seeing patients, but people have resorted. First of all, like I have the luxury of not being the primary breadwinner of my family, right? So if I chose my job because I was concerned for my safety, I could do that. Many, many people cannot afford to leave their jobs. So when you're put in situations where you don't have enough PPE, you almost throw yourself in the fire and you say, well, I need the job. Now's also not the time for me to not be employed. So many of my colleagues I know have been working in very stressful situations, not having proper protective, equipment. So for me, that's probably been the most discouraging thing to come out of all this, is that there just hasn't been enough to protect us. How our complaints and how our concerns have been kind of waived as like, well, just do your job. And it's like, how do you not protect your providers? Ultimately, we are seeing your very sick patients. I think the hospitals now have gotten better from what I've heard, especially the wealthier hospitals. I know Northwell has gotten better with their PPE. Other hospitals are getting better, but there was 1 month, I would say a solid month, where there wasn't. And we got a lot of people sick because of that. We got a lot of providers sick because of it. My own colleague got sick, but then we were all tested for it. So, so it's scary. You just don't know if it's just a matter of time before it's you, really.
Yes, so unfortunately, that is the case in most of the places across the U.S. and even worldwide. It's not almost exactly like sending soldiers to war without weapons. You know what I mean? So that right now our doctors are our fighters. They're the people on the front line.
Yeah.
So we definitely need more of PPEs, and we need better utilization and just overall better productivity and
100%. Yeah.
Yeah, great. Okay. So Nida, can you walk us through your daily routine of disinfecting yourself? Just coming and leaving home to go to work. Can we just?
Okay. So, in family medicine, we actually choose not to wear white coats. But I guess what I have been doing is I dress normal. I'm already aware throughout the whole day, I'm not going to adjust this. I'm not going to touch my eyes. I'm not going to touch my face. So that has been like banned from my life, So so I make sure that, I'm mentally prepared to not touch my face. Then I put on, I sit in my car and I get to work. And right before I get out of my car, I put on my N95 and I double it up with a surgical mask. And I put on my gloves and, I get out of the car and I walk in and I throw those gloves away. And then I don my gown, which is a repetitive gown. So it's just kind of the best I have. And then we put in, if I'm seeing patients, I'm going to be putting on my eye shield, and then I just double up my N95 with a couple more surgical masks. And then before I even begin my workday, I always Lysol my entire workspace. So I've been going to work maybe a half hour early just so I can disinfect. So I start with everything from the screens to the mouse to the keyboard to my sink, anything I'm going to be touching, my drawer handles, the patient beds. I do that, and I the blood pressure cuff, literally any instrument I'm using, I will spend 30 minutes just disinfecting because I think that's just so important. Then I will go ahead and disinfect all the doorknobs I'm going to be touching. And that's kind of been, and then I know my medical assistant is really great too, and she will help me kind of disinfect or in between my days she'll come and just disinfect my room again. But I always do the initial disinfection of my space. And now the second part and the most worrisome and crucial part for me is going home, because I have two small kids, and I have two small kids and two elderly people, my in-laws, who I take care of. my father-in-law has every single pre-existing condition you can think of. If you have a list, you can check every single thing off. So like, everything. So I have to just be really, really careful with myself. So I come in through the garage. I do have a change of clothes there, which I change into. And, I put on new gloves again and I walk through the house and I put the dirty clothes I leave in the garage and I put in a bag, which I'm going to come and get later. And I go straight to the shower where I take a very hot shower. And, I like change into normal house clothes and then I'm able to like greet my family. And
wow.
it's the saddest thing because one of my most favorite things about coming home from work was always my kids running to me. That's like the first thing they do. They're like, Mama, like we missed you. And I get the big hugs. Now I have to hide from them so they don't see me. And I run upstairs and then I come see them, and then they're like, oh, like, what are you doing? And, kids get nervous. They don't understand why things are different. They already don't understand why they can't go outside or why they can't go to school or why is my mom hiding from me first when she comes home from work, So it's all part of the process. But you know what? Every single precaution that you take goes a long way. I even disinfect the bed that I sit in afterward. Like, you have to. I disinfect my cardboard boxes from Amazon. Like anything, you have to take the precaution because at this point it is life and death. So if it's someone's life, it's worth every bit of precaution you can take.
Exactly. And it's very unfortunate that we have to do this, that healthcare professionals, once they go back home, and as you said, your home is your safe haven, basically. Yeah. And once you go there, you're expecting your child to hug you and kiss you. Yeah. But right now, we can't risk it. I mean, you love your child, absolutely, but you can't risk the chance of you possibly infecting your kid. And that brings me to another question. So each patient that you're seeing has a family, husband, a wife, and friends. Does that increase your level of anxiety while treating these patients?
Definitely, because as with COVID, as you know, it's very infectious. And if one family member has it, it's very likely that the others either may be asymptomatic or have it or are symptomatic. So in a way, I'm not just managing the patient, you end up managing the family too.
Yeah.
And also we also have to take certain socio like economic factors into consideration. Not many people have big homes. Not many people can isolate themselves to their room.
Absolutely.
So are like, well, we live in a 1-bedroom apartment and all 7 of us have it. So what should we do?
Exactly.
This is hard because I can't be like, hey, step outside or go to your neighbors. It's more like, listen, do your best. Okay. Try to maintain distance. Wear a mask around your loved ones. All right. Especially if there's elderly, if you can just separate the elderly in your home to like a more isolated location, do that. Amongst yourselves, definitely wear a mask. Get a hold of some masks again. If you can't, there's alternative to masks that you can wear, cloth around your face, literally anything. So the anxiety is there because I have patients who've been pregnant, who tested positive. I've had patients who are freaking out because they're like, I have a newborn at home, or I have 2 small kids, or, I think I'm positive because my coworker died, and I think I'm positive because I've been working with him and I have some symptoms. And there's many, many different heartbreaking situations I found myself in over the last 6 weeks that have actually made me cry a lot when I've come home because I'm so stressed for them. I'm stressed for their families. It just doesn't stop with the patient because you think like, oh my God, I hope, their elderly parents don't get sick, or I hope their small newborns don't get sick, or I hope this mom doesn't miscarry because she's COVID positive. Like, so it never just ends with the patient. I think when you look at the patient, you look at the whole patient, and that means who they live with, where they live, what their just general environment is. So the anxiety is harder, and as providers, sometimes we can emotionally detach from our patients. We can, especially when it's general things like diabetes and blood pressure, blah blah blah. In this situation, I found myself very attached to my patients, worrying about them in a way that I didn't even, think I would be so worried. And I'll give you an example. I hope I'm not like running on a tangent, but my dear, dear, dear patient of mine who I saw a week and a half ago. I told him to come in through our drive-through testing COVID site. I managed him over the phone. I sent some medication to his pharmacy. I had a friend of his pick it up, drop it to him so he wouldn't have to go outside. I found he just deteriorated in a day and he passed, And then as I'm going to work, I'm thinking, I'm going to call him. And I think what I'm going to do is I'm probably going to start him on this, or I'm thinking of like what I'm going to do for him as soon as I get into work. And as soon as I get told he's already passed, I don't think I've ever been so floored and so upset in my like whole life. I was like, but I was just going to call him and he was just fine the other day. And what do you mean he's passed away? So some of what we're dealing with is just this unpredictability. Some people take a while to go down. Some people are going down like this.
Yes, it's definitely unpredictable. I'm so sorry to hear that.
Thank you.
Okay, so Nidha, are you are you afraid of catching this virus and possibly spreading it to your family, your colleagues, or even your other patients?
Oh my God.
Is that a concern?
It is. I think it is a paralyzing fear that I live with. I just live with it, So I think I mentioned that I took a job with Northwell's Health System on their emergency events team, right? On their COVID unit. I'm going to start that early next week. Maybe if you talk to me next week, I don't even know what I'm going to have to say, but like, I'm not even sure if I'm prepared. Like, I'm mentally trying to prepare myself for what I'm putting myself into. I find myself having lied to my parents for it too, just because their level of anxiety and worry for me is like so high. I've had to be like, oh, I'm not going to do that, and then finding myself lying to do something that's good, but this is the fear I'm talking about. Our parents are worried for us. We are worried for our kids because I don't know. And exactly, like the 30-something-year-olds aren't spared from this. There's some cases of 30-something-year-olds who end up developing like, small clots as a result of this. And they're dying from like, miniature clots dispersed throughout their whole body. I don't know. There's so many cases that you hear that are horrifying, but it could be you, right? So putting yourself in a situation, there is a momentous risk that comes from it. I put my family at some level of risk. Now, I already take a lot of precautions. I'm fully prepared to isolate myself to a room, at least at night. I will not be sleeping with any of my other family members, during the time that I'm on this team. I plan on wearing a mask at a minimum. I plan on not kissing my kids at a minimum, which is something that I've had to, understand that I'm doing it. It's temporary. I'm doing it. It'll be for a couple of months and it'll be okay. And that's just what I have to tell myself, I obviously not separate myself completely from them, because if I could, for them, I would, they're small, they're 4 and 2, I pray that like God's given them good immune systems and even if they do come into contact with it, they can fight it off. I pray that I can take my precautions and I pray that I'm given proper PPE so I can at least, do my 100% in protecting myself so I can protect them. I have my precautions set in place. I am petrified, I think, of getting anybody else sick in my house. But all we can do is like, trust that, I'm going to put my faith in God that like, he will take care of me and take care of my family and do our 100% in our health setting so that we can provide good care for our patients and just do some good. I've ultimately reached the conclusion that people are dying, our family members, friends, cousins, people are sick. People are ending up in hospitals. They need healthcare providers. Me having the knowledge and the degree, how could I not? Like why was I a PA in the first place? So for me, this is something I have to do, and I have the support of my family, thank goodness, to do it. And hopefully we'll emerge, safely at the end of it.
Hopefully we do. Nidha, do you think that with this increasing and growing pressure on our healthcare workers, that we are inescapably traumatizing medical professionals and hence breaking well-established systems of care? Do you think we're doing that?
Um, I think, unfortunately, it is beginning to seem as though healthcare professionals are a little disposable. And I don't know if that's even correct, but if one of us gets sick, we get replaced by another one of us, you know? So and I'm not saying it's easy to obviously do that, but I'm saying that's just the way we have become right now. Like, if one is out, they try to fill the gap, try to fill the gap. I can't tell you, I've been called by maybe 3 different places asking if I'm available, and that's because, the more we, and this is why I say PPE is so important, because the more we put the health and, the safety of our providers at risk, the more we, run out of providers, to be honest. So right now, like, yeah, it is risky. This is like really risky stuff. I think we are compromising, healthcare providers. Definitely. I think it's getting better. But I think the last month has shown me that they really did a bad job of like protecting us. They really let us down. They really let us down. I'm not even sure if that answered your question. I probably just talked about something else, but if
No,
you're not
no,
to it that you want me to answer, I'll happily do that.
that was perfect. Well said, Nada. So it actually brings us to another point that a lot of people, so many, have compared COVID-19 to the flu. But it's not every year that we close businesses and we close schools and we say, hold on, everyone, I don't want to see more than 5 people in one place or more than 3, for example. Do you think it's fair of us to compare COVID-19 to the flu?
Um, I don't think we can necessarily say that. I think at the beginning, I'm not gonna lie, I was dismissive of it because I was like, listen, we have influenza to worry about.
Yeah.
That was me in primary care when this was like going back a few months, being so dismissive. But you know what? Joke's on me, because I was really wrong. As this thing began to spread, as it began to affect people on such a global level, as we realized how infectious and virulent this virus truly is. And I have a background in molecular genetics, and I was reading this genetics paper, which is talking about like just the genetics of the virus. Like, influenza is a virus that's been going through humans for quite some time, right? So it's recognized by us in some part. We can fight it on some part. This virus is completely unknown, virus of unknown origin, which has come from you know, came from this small little town in China, essentially, or village in China. And it's unknown. It's DNA we do not recognize. Our body has never seen it before. It's completely foreign. So the response that we are having to it is so different to a response that we would have with the flu. It's entirely
So,
different. It's not at all recognizable. Our bodies have never come across this. So in that sense, it's scary. It's unknown. We don't have a vaccine. It's just hard to compare it to the flu, because I think this is just so different to the flu.
exactly. And I think one of the major mistakes that a lot of people have done, that in the beginning, by definition, by comparing this new virus to the flu, we have subsequently made a lot of bad decisions, such as delaying lockdowns. Not even right now, some places don't even have lockdowns. Saying no, social distancing is a myth, don't do it. So definitely, our initial approach in many, many countries could have been improved, if I
Yeah,
just may say.
definitely.
Yeah.
And learn from the US. Learn from us. We didn't implement any kind of appropriate social distancing or lockdown measures, for such a long time. And we're paying heavily for it with the lives of our citizens.
Needlessly and unfortunately. So, a lot of people right now are looking at the situation at Wuhan and how the city has officially lifted up the first lockdown due to this COVID-19. What lessons do you think we can learn right now from Wuhan in retrospect?
I mean, um, one thing we can definitely learn is that the measures they took to contain this thing were, at some point, people thought they were extreme, right?
Yeah, the beginning, correct.
They locked down the entire place. People were, I don't even know exactly the details of what they did, but I know that they're very, very extreme measures. And compared to what we've done, we've been very lax, like, hey, maybe you shouldn't go outside. Like, that's kind of been the vibe here, but like, that's really just not what we should have done. Wuhan can now lift, its ban on people and allow people to go outside and, be with the rest of the world, because they did the hard part already. They contained this thing, and they really contained this thing. We have done a partial job of containing it. Therefore, we're not going to reap the benefits of this anytime soon, which is why when you ask, like, are we towards the end of it? I think we're very much in the middle of it. I think we're right in the middle of it. And I don't know how much longer, because the US is also so vast. It's so many different states,
Correct.
And like New York, maybe if New York begins to see some relief, I don't know where else it's going to begin to, pop up. And that's always going to be a risk to anyone who hasn't had it yet. No matter how long as this thing is around, it's a risk to anyone who has not come into contact with the virus. So
definitely. Yes. It's going to be a long time to get there. I agree with you. So finally, Nidha, do you have a specific message that you'd like to give the people that are listening to this podcast and the medical students specifically around the world? Is there a message you'd like to tell them?
I have probably the best message that I take to my own heart, and I would love to also share with you guys.
Please do.
Never, ever forget why you entered medicine. Never forget that. Like, at the core of it, it doesn't matter what you know, what your knowledge base is. It doesn't matter at the end of it, like how many years experience you have, or, what your talents are. Ultimately, why did you go into medicine? Remind yourself that. Or if you don't know, ask yourself that, right? Because no medical professional goes into medicine primarily for the money. You go into it because you love patient service. You love to serve others, right? You want to help others. Like, when people ask me why I love being a PA, I'm like, I love helping people. I think I'm damn good at it. I think I am. Well, what the world needs is compassionate, kind, loving, caring providers. So we can never forget that at the core of all this, that the most important thing is to be kind, to be compassionate, and to provide that care to your patients, and to serve and to provide the service to them. Ultimately, this is why you entered medicine. No matter how far you get into your careers, never, ever, ever forget that. If there's one thing that I can tell you, is that never forget giving to your patients and remembering why you did this in the first place.
Yes, thank you very much for that profound message. Hopefully, it becomes louder and louder every time. We must never forget our true and first purpose, if I must say, when we all entered medical school. So, everyone, I just want to say that with every passing day, the number of cases and deaths due to COVID-19 increase. But at the same time, you are also seeing a lot of recoveries. And that gives us immense hope for a better outcome in a time where hope can be very rare to find. Students Against COVID campaign will try its best to amplify the voices of the victims and highlight the extraordinary effort displayed by medical and healthcare workers, such as yours, PA Nidha. Everyone, please tune in for more future interviews. And Nidha, I'd like to give you our sincerest thank you for sparing from your valuable time to sit here with me today and talk through these different questions and different aspects. Your dedication, courage, and absolute commitment really deserves our deepest gratitude and admiration. Your service will forever be remembered, not just today, not just because of COVID, but every single day. And I'd just like to tell you and all our doctors and nurses that you are not the front line, you are the only line.
Thank you, Farah. Thank you so much for that. Thank you for this. Thank you, guys.
Thank you so much.
Thank you.
It was my pleasure. Thank you so much.
Of course, Farah. Take care, please. If you ever need anything, please don't hesitate to reach out.
Thank you so much. Thank you.
Thank you, guys. Take care.